Hey everybody, this is Beth Durinsky from Odyssey Insurance and Investments, and you're listening to the podcast, Real Insurance Made Simple. As a working mom of young kids and a small business owner, I know firsthand life happens. So come along with me and learn how your insurance policies work when real life happens and you need them most. Welcome back, friends. It is episode 2 for our Medicare mini-series, and this week we are going to be discussing Part B. Last week we did discuss Medicare Part A, and in addition to the Part A breakdown, we also had our very boring lingo terminology breakdown at the beginning of that. So if you would like a recap on that terminology, go back and check out the last episode. I also want to reiterate that these discussions on Part A and Part B pertain to original Medicare. They do not pertain to how Part A and or B works with a supplement or being replaced by an Advantage plan. We are strictly looking at Part A by itself and Part B by itself, not pairing it with anything else. However, we will further explore how they pair with other options in later episodes. There's also a scenario where you could potentially have Part A and not have Part B. For example, if someone has employer coverage, they may be turning 65 and choose not to retire, so they may delay their Part B premium or their Part B coverage, so they don't have to pay that Part B premium since they're getting employer coverage. There's also other scenarios that this pertains to, but this is one great example, which we'll touch on a little later at the end of this episode. With that being said, let's hop right into our discussion on Part B. Part B coverage is going to be coverage that is opposite or different than Part A. Remember, Part A is hospital inpatient coverage. If you're not sure what that is, please go back to the last episode to get more information on that. It is different. Part B is going to be for outpatient or medical coverage. So what does Part B cover? It covers services from doctors and other healthcare providers. Things like doctor's visits, labs, x-rays, MRIs, things like that. Things that you usually utilize on a routine basis or need that are medically necessary. You will also get coverage for some outpatient care, home health care, durable medical equipment, which would be things like wheelchairs, walkers, hospital beds, and finally, some preventative services would be included under Part B coverage from Medicare. It is important to know that Medicare typically only covers things that are covered under the list of their approved services. If you are trying to receive or obtain a service that does not fall under Medicare's approved list of services, then you may be denied coverage by your Medicare benefits. Now, of course, this does not apply to everything, but the general rule of thumb, again, this is not for professional or legal advice, but the general rule of thumb is if it's medically necessary, then Medicare typically covers it. Again, just a general rule. So, how does Medicare Part B cover as it relates to your cost? Medicare Part B does have an annual deductible of $240 per year. In addition to that, once you've met or satisfied your deductible, again, the amount you are responsible for first is $240, then at that point, you will have a Part B coinsurance that kicks in for 20% of every bill that is received after that point. So, just to recap, $240 is your responsibility first with your annual deductible. And then once you've met that, then you will be responsible for 20% of your Medicare approved amount. So a quick example would be you went to the doctor, you have already paid $240 towards your deductible in your first doctor visit, or maybe your first couple doctor visits, based on the Medicare allowed amount and approved amounts. So your deductible has been satisfied, and now the next thing in your medical needs have came up, whether it be labs or x-rays or whatever is next, and your doctor's office completes the service, they submit a claim to Medicare, and Medicare has indicated this is the amount they're allowed to charge, and based off that, let's say it's $100. Of that $100, once you've met your deductible and you've already satisfied that, your responsibility is going to be 20%. So your responsibility of that $100 bill would be $20. As it relates to cost, Part B, I do feel like is a little bit easier to understand than Part A. Part A has that 60-day deductible and per day rates and all of that. Again, go back and listen to that. It's a little more detailed and a little more nuanced. With Part B, you have your $240 deductible and then your 20% responsibility for anything over that. Anything that is approved by Medicare and Medicare allows for, and it's a covered service, you will only pay 20% of that bill after you've met your $240 deductible. Again, if it's not a Medicare approved service, then there's no coverage and you could be on the hook for it all. Your doctor's office or the billing departments are usually pretty familiar on the coverages that are acceptable versus what is not. You can always reach out to your local doctor's office or your local agent to help find those resources for you. Moving on to the next aspect of Part B is what would Part B cost me when it's time to enroll? Part B, again, is going to be different than Part A. Part B has a monthly cost, with one exception to that monthly cost rule. If someone qualifies for low income subsidy or Medicaid or some type of federal or state financial assistance, they may have their Part B premium reduced or covered by that financial assistance. Aside from being able to receive that financial assistance, Part B will have a premium, and that premium standard cost is $174.70 for the year 2024. Again, just like with other numbers on Part A, this number is subject to change every year. So this is just for an example at this point in time. It is not set in stone and is subject to change. But wait a minute. We are not in the clear yet. There is possibility for something called IRMA to impact your Part B premium. What is IRMA? It stands for Income Related Monthly Adjustment Amount. This amount is used based typically off your tax filings. So because of that, they do say they look back 2 years based on the year you're in, when you've last filed your taxes, etc. Regardless, they're looking approximately 2 years back to look at your total income in your tax filings. There are different brackets if you file single versus married, but your income could impact that monthly premium amount. The $174.70 that I just provided is the base or minimum cost for Part B premiums. There are actually 5 additional thresholds for premium increases based off of the income brackets that someone may fall in. So there are essentially 5 different levels in which you could take premium increases for Part B based on that income. The person who's going to determine that is not really a person. It's actually the Social Security office administration at the time of applying. Now, there are always exceptions to the rule. You can ask for appeals and ask for reconsiderations for your IRMA or your income-related monthly adjustment amount, but typically once you've made that income, it already impacts it. Finally, your agent doesn't really have any determination in this or any say in this, but they can help navigate some questions you may have as it relates to your IRMAA or income-related monthly adjustment amount. Your Part B premium is usually paid on a monthly basis that does come straight out of your Social Security benefit check every month, unless you are choosing to not elect your Social Security benefits. And then at that point, the SSA office will bill you quarterly. And that amount is going to be around $524 per month $524 per quarter based on 2024 rates. The final question that typically people ask is, when can I start enrolling in Medicare? Again, this is going to be the same as Part A. Your initial enrollment will be that 7-month window, the 3 months before you turn 65, the month you turn 65, and up to 3 months after. If for some reason you missed this, there is the general enrollment period between January 1st and March 31st. But if you're enrolling in the general enrollment because you might have missed your initial enrollment period, then it is important to know you may get penalties moving forward at that point. So don't delay it any further. Get enrolled as soon as you realize you've missed it to avoid those penalties. And finally, there is something called the special enrollment period, which gives you the opportunities to potentially enroll like when you leave employer coverage. As previously mentioned, someone can turn 65, obtain Part A, and then continue to work and receive employer-provided coverage for maybe 2 more years till they're 67. It is when they turn 67 that maybe they decide they are ready to retire and they want to get Part B. So Part B would then qualify for a special election period due to leaving your employer-provided coverage. You do still want to start that process about 3 months before you know you want to retire, or when you get an idea, so you have plenty of time to contact the Social Security office, apply for your Medicare benefits in coordination with your retiring date, just to try to prevent any of those gaps in coverage. This is just one example of how a special election period may apply to your circumstances. They have several out there for several different life-changing events. But when you're ready to retire, this is something your local agent can also help walk you through as you're navigating that process. Otherwise, this is a good summary of Part B today. I hope you guys all enjoyed it, and come back next week as we navigate Part C, otherwise known as the Medicare Advantage Plan. Thank you all for listening today. We hope you found this episode helpful and informative as you navigate the world of insurance. As a reminder, this podcast is never for legal or professional advice, and you should always consult your local and licensed insurance professional. We wish you a week filled with love and blessings from the team at Odyssey Insurance and Investments.